Good afternoon. Thank you for watching our live update for Tuesday, March 9th. Today, I have a number of things to share with you, and then Director of Dining, Scott Jonté, will provide you with some details about our plans to resume in-person dining in the marketplace. After Scott, Chaplain Logan Augustine has our pastoral care segment today. Let me start out with a quick COVID-19 update. We have good news to share regarding COVID-19 in Westminster Canterbury. Yesterday, 2 of the independent living residents who were being cared for in the COVID-19 positive unit were considered recovered from COVID-19 and were subsequently transferred back to their rooms in Parsons Health Center, where they will continue to recover. We're so happy that they're doing well and on their way to getting fully recovered. Because of these 2 individuals transferring back to Parsons, we have now closed the COVID-19 unit. As of yesterday, that unit is closed, and it's still available for us if needed, but God willing, we won't need it anymore, and we'll be able to stop doing that. 1 independent living resident who had tested positive continues to be cared for in the hospital. This is, at this point, our only case of COVID-19 at this time. Also, great news is that we have no employees who have tested positive for COVID-19, and we have no active cases within our staff. Although we do still have some staff who are in quarantine due to having COVID-like symptoms or having been exposed. You will recall that a couple of weeks ago, we had our final vaccination clinic, and 98.5% of our resident population is now vaccinated for COVID-19. This is an outstanding result, and we should all be very pleased with that. At this point, we're currently at 72% of our employees that have been vaccinated. As existing employees choose to become vaccinated and new employees get hired or new residents move into our community, we have been looking for ways to help them be vaccinated, as the supplies and access to clinics have been limited, especially for workforce individuals. So finally now we have formed a relationship with a pharmacy provider. That provider's name is Common Share Pharmacy. They will be providing us with clinic opportunities where we can send people to them for vaccination. As we have groups of future residents or staff or contractors that need vaccination, we will be able to schedule an appointment for them. And our first group will go to the Common Share Pharmacy this Friday to get vaccinated. So that's really good news. That's an exciting step as we continue to work to get the most protection we can for this community. We know that you've heard that the Centers for Disease Control and Prevention, the CDC, issued new guidance for vaccinated persons yesterday. It's just another of the very exciting steps that we're looking forward to, as we're all very eager to get back to something that looks normal and get freedom from masks. But we do have a few things to remember as we move forward. So a few reminders for you. First, and this will probably be true for a while, not all of our Westminster Canterbury community is considered fully vaccinated at this time. So those that got their second shot from CVS 2 weeks ago, they who got their second doses at the clinics on the 24th and 25th, they will reach the 2-week point later this week, either Wednesday or Thursday of this week, when they will be considered, you will be considered fully vaccinated. But we still only have 72% of our staff that are vaccinated. So we need you and we want you to continue to be cautious. We desperately want to remain infection-free, and we really, really seriously want to keep our programs and services open after we reopen them. So we're going to want you to take it slowly and be cautious. Second, the news that you've heard from the CDC, or that many of us have heard from the CDC, is guidance that applies to people who are living outside of a healthcare setting. Parsons Health Center and assisted living are considered healthcare settings. We have not yet gotten guidance on how to move forward within healthcare and assisted living, but we do expect that we will be getting that guidance in the near term. So as soon as we get it, we'll share it. But the guidance that CDC gave out yesterday does not apply to healthcare residents and assisted living residents or staff. For independent living residents, the CDC advises taking into consideration the risks of the individuals in your community. And what that means is you need to take into consideration the fact that most of you and most of your neighbors have underlying medical conditions or multiple comorbidities. These and other factors can put individuals at severe risk even if they're vaccinated. So we have to be careful. We would continue to encourage you to move forward using an abundance of caution as we slowly reopen some programming next week. The CDC guidance from yesterday says that fully vaccinated individuals should continue to wear well-fitted masks and social distance when in public. Much of our campus is considered public space. At this time, we will still require masks throughout the campus when you are around other people in public space. Wearing a mask when visiting with non-vaccinated individuals who are at increased risk for severe COVID-19 disease, and when visiting with non-vaccinated individuals from other households. This likely applies to many of your family members and friends out in the community who've not yet had access to the vaccine. So wear your mask when you're around others. If you don't know if they've been vaccinated, wear your mask. Avoid medium and large size in-person gatherings. That's probably the greatest risk. So stay away from larger gatherings off campus. And then if you have any symptoms, it doesn't matter whether you've been vaccinated or not. If you have any symptoms consistent with COVID-19, let the clinic know and we'll get you tested. It's still better because we can still get the virus and we may not get sick. So if you have any symptoms at all, continue to do what you've been doing, work with the clinic, let's get you tested. Now, you've probably heard in the news that the CDC, the news we got yesterday from the CDC is that fully vaccinated individuals in a private setting, such as at a private home, may visit with other fully vaccinated individuals in small groups without wearing a mask or social distancing. That's great news. That's what we've all been hoping for, right, is that we can spend time with family or friends that are vaccinated and feel safe. It's really about being safe. It's not about wearing the mask. If you're in an environment where you're with people who are known to be vaccinated and you're all well and symptom-free, the risks now are low enough that we can allow you to take your masks off. The other thing that the CDC says is that you can visit with non-vaccinated individuals from a single household indoors without masking or social distancing, provided that none of those individuals, non-vaccinated individuals, or their household members are at increased risk for severe COVID-19 disease. What that means is essentially you're taking the risk of exposing somebody and they know it. And if they're okay with it, then it's in a private setting, you can do that. If you're uncomfortable being around others in private without a mask, you need to do one of two things. Well, one of three things, really. One, you need to state that you're uncomfortable with it. It's not for everyone, especially if you have underlying comorbidities and it makes you uncomfortable. Wear your mask and tell people you're uncomfortable with it, or avoid the situation for now. Things are going to continue to get better, and so rushing, if you're in one of those situations where you're not safe or you don't feel safe, avoid it for now. It will get better, and I think it's going to get better relatively soon. Westminster Canterbury is restarting some staff-led group activities in public spaces starting next week. We encourage you to wait on the other private small groups, resident-led groups for now. Not for long, but for now. Let us get things started up here, and let's make sure we're all safe before we start doing too much of that. We ask that you keep following the principles that have kept our community safe, including wearing your mask and social distancing whenever you're in public space. That's the main thing. Around others, as we begin to reopen this community and we started to allow some visitation, and that's not too far off here, we're going to have individuals on this campus that aren't vaccinated. And as I said, staff aren't yet fully vaccinated. As the guidelines change, I guarantee you we will continue to keep you updated with every change. So that's it as it relates to the COVID stuff. We'll have more about all of this later this week and next week. Now I want to share some difficult and hard news. As we've all been through, this has been a very difficult year in more ways than we can count. One of those is that in the past month, we, the staff, have had to say goodbye to two beloved employees who've passed away. The first is Patsy Briggs, known as Miss Patsy in our Child Development Center. She passed away in February. And then this week, we said goodbye to Alvin Brightly. Al has been a fixture in our housekeeping department for years. Both were longtime employees and superstars. It's never easy to say goodbye to our friends and coworkers in this way. Both of these individuals leave huge holes in this community, and both will be dearly missed. Their families, friends, and coworkers are in our thoughts and prayers. Lastly, for me, last week we shared a lot of good news about programs that will be restarting on Monday, March 15th. I hope you're taking advantage of those opportunities and signing up for activities that are about to start. They are all going to be essentially by appointment only, so make sure you get signed up because we do expect that those activities and programs are going to fill up quickly as we begin to ramp things up. So I hope you can get signed up for the activities that you care about. That's it for me today. Scott Jonté is up next with a dining update.
Good afternoon, everyone. As you may have heard, dining will restart dining in person on Monday, March 15th. As you may have heard, this will begin taking place in the marketplace. We'll be offering the full service experience. This decision was made because we felt in dining we could better serve your needs and meal options for a a la carte type menu, and we look forward to serving you on Monday, March 15th in the marketplace. As you may have heard, reservations will be required by calling extension 6030. For now, we will only offer reservations for parties of 2. Reservations are only accepted 7 days in advance. This is primarily because we'd like to offer every resident within Westminster Canterbury the opportunity to dine in the marketplace. Please be assured that if you do call and leave a message, your call will be returned by one of the supervisors and verify your reservation time and date and the individuals in your party. Also, there's been some changes to our delivery service, and this will begin taking effect as well on Monday, March 15th. The best thing you could do is to refer to the information that was placed in your mailboxes last Friday titled Restarting Programs. This document will serve as a guide, particularly on page 4, which lists all the information about dining, phone numbers, who to call, and all the relative information that you may need to know about dining. As always, feel free to call us at any time at extension 6030, and we'll be happy to answer any of your questions at any time. Thank you very much. Up next is Logan.
Good afternoon. I'm Logan Augustine with Pastoral Care. A few announcements for you today. Please join us for worship this Thursday at 10:30 a.m. on TV 970. Reverend Dr. Art Thomas will preach, and Sally Maynard will play the piano for us. We are also upgrading the AV equipment in the Spiritual Center, so please bear with us as we fine-tune the system. We realize that there have been some issues with visuals and with sound, and we are trying to get that resolved as soon as possible. We are so excited to be able to broadcast from this beautiful new space. We are in an in-between time. As we sit in the midst of Lent, we wait for the coming joy of Easter. As we have been sitting in pandemic tension for some time now, we wait for the coming joy of reopening and regathering with those we love. A new beginning is on the horizon. As I walk around campus and see the beautiful flower arrangements, or as I listen to these video updates with news of reopening our campus just one step at a time, I feel encouraged and hopeful. It is undeniable that we have all been challenged and changed in some way during this time. So I invite you to hear the following words from John O'Donohue from his work entitled For a New Beginning. It's found in his book, To Bless the Space Between Us. In out-of-the-way places of the heart, where your thoughts never think to wander, this beginning has been quietly forming, waiting until you were ready to emerge. For a long time, it has watched your desire, feeling the emptiness growing inside you, noticing how you willed yourself on, still unable to leave what you had outgrown. It watched you play with the seduction of safety and the gray promises that sameness whispered, heard the waves of turmoil rise and relent, wondered, would you always live like this? Then the delight, when your courage kindled, and out you stepped onto new ground, your eyes young again, with energy and dream, a path of plenitude opening before you. Though your destination is not yet clear, you can trust the promise of this opening. Unfurl yourself into the grace of beginning that is at one with your life's desire. Awaken your spirit to adventure. Hold nothing back. Learn to find ease and risk. Soon you will be at home in a new rhythm, for your soul senses the world that awaits you. The following prayer is attributed to Saint Teresa of Avila. Let us pray. May today there be peace within. May you trust God that you are exactly where you are meant to be. May you not forget the infinite possibilities that are born of faith. May you use those gifts that you have received and pass on the love that has been given to you. May you be confident knowing you are a child of God. Let this presence settle into your bones and allow your soul the freedom to sing, dance, praise, and love. It is there for each and every one of us. Amen. Thank you for joining us this afternoon, and we will see you on Thursday at 3 o'clock for the next update.